University of Kansas Hospital didn't have as strong as reputation when we first started 17 years ago.
Our decision to pick SPM at a national level rather than a local firm was truly tied to our aspiration to be the best in the country, to lead the nation, and you've got to have partners who have that same aspiration.
SPM really specialized in academic medicine. That was really the main reason that we picked them.
In order to make our communications distinctive, but also give it a cachet as well as some notoriety, we thought a national spokesperson would provide that in the marketplace, and it certainly has worked.
I like all of the commercials just like one likes all of their children. But I do have to say that the two series of commercials that we did that I am probably most fond of is the first series with Tom Skerritt in 2004.
Without surgery, that's possible. It's looking pretty good.
We had the courage to go out and talk about survival rates. And so we had Tom Skerritt walking down with some of our physicians.
And part of why more people who come here live.
That didn't go over well with some of our folks locally. The fact of the matter is, it was true. We had the data to prove it. We had the courage to put it out in front of people.
While I was aware of the University of Kansas Hospital, certainly was not aware of the level of quality, the level of research, the level of medical care provided by the physicians and staff here. Understanding that, it was certainly then important to communicate it.
Why would you go anywhere else?
SPM's style is that they put strategy behind everything they do. They've done their homework. And in our case, it helps the consumers in this market really understand about us, what's special about us, so that they will want to use us.
SPM has really worked at understanding us, not just because they read about us or they read our annual report. They've listened to us tell stories about our patients, about our teams. They've listened to us, they've seen it happen.
In fact, we've just had conversations with one of their leaders who has a very close friend who's a patient in our hospital, and she said to us the other day,
she ended up staying here for 19 days. She was in the ICU and they almost had to remove her colon completely, and she was on emergency surgery watch. One of the nurses brought her a pair of pajama pants. One of the physicians brought her an iPad and magazines to use. That is not typical stuff. That really is about how people are devoted to taking care of patients.
SPM is in sync with us, not by accident. I think they've worked at it. They've come to our events, they've spent time at Treads and Threads, they've spent time at Girls Night In, they've come to the Hall of Fame event. They've also spent time just getting to know our teams, getting to know our staff, spending time even visiting with patients.
Healthcare is really complex. There's so many things that we're regulated by and held responsible for and need to be accountable to. They're strategic and they're also unbelievably gifted creatively, and that does make them different.
Marketing academic medical centers is different. In advertising, there's this old adage that says, you know, it's not brain surgery, you're not curing cancer. It's different. This is absolutely what we're about, and we have an obligation to help get the word out that where you go matters. It could save your life.
I've been working with the same people for 17 years. When you have that consistency and that continued dedication, that's what makes this place work so well.
It is so fun to watch the unveiling of the next ad campaign.
Last year, more than 400 people with conditions so severe statistics show they would have died came to the University of Kansas Hospital and survived.
I think the favorite commercial is the one that's going to be unveiled next.
We are very appreciative of SPM, and we treat them like we treat each other.
I think they're so deserving of an award because they've been our partners from the beginning, and they've really helped us become who we are today.
Why would you go anywhere else?